Welcome to Deep Dive, your daily dose of medical case discussion by Medvarsity. Today we're diving into the world of multi-ligament knee injuries. These are some of the most complex injuries you can have in the knee. So we'll be looking at how they're diagnosed, what the treatment options are, and what the road to recovery looks like.
You know what makes multi-ligament knee injuries so interesting is that there isn't a one-size-fits-all approach. You really have to look at the whole picture, how bad the tears are, which ligaments are affected, and what the patient's individual needs are.
Yeah, and that's really important because the research shows there's a lot of debate in the medical community about the best way to manage these injuries, especially when it comes to surgery. Is it better to operate right away or wait?
That's right.
Yeah.
Some doctors like to wait and see how things progress, maybe for 6 weeks or so before deciding on surgery. Others think it's best to operate as soon as possible. A lot depends on the specifics of the injury, like if a ligament needs to be reconstructed or just repaired.
So let's look at a real-world example. One of the sources we have today focuses on a basketball player who had a pretty serious knee injury. The MRI showed tears in 4 different ligaments: the ACL, PCL, MCL, and the fibular collateral ligament. I'm amazed at how much damage can happen in just one injury.
It really highlights how important MRI is for diagnosing these injuries. With an MRI, doctors can get a very clear picture of what's going on inside the knee. Knowing exactly where the tears are and how bad they are is crucial for making the right treatment decisions.
And this particular case takes us on a visual journey as well. There's a series of images taken after the surgery, showing the progression of the patient's knee. They had quite a few procedures done: a single-stage double-bundle PCL reconstruction, ACL reconstruction, and repairs to both the fibular collateral ligament and the medial collateral ligament. It's incredible to see how precise these surgical techniques are.
What's fascinating about this case is that it shows just how far surgical techniques have come. Now, surgeons can address multiple ligament tears in one go. This means potentially faster recovery times and better outcomes for patients.
And speaking of recovery, the source talks about the role of stress tests after surgery. Tests like the Varus and Valdez stress tests are used to assess how stable the knee is. These tests help determine whether the repaired or reconstructed ligaments are doing their job of supporting the joint.
Exactly. And what's interesting here is that this patient was able to achieve full knee motion just 8 weeks after surgery. That really underscores the importance of getting moving early on and having the right physiotherapy.
That makes me think of the saying, motion is lotion. I'm curious, what can happen if someone delays rehabilitation after a multi-ligament knee injury?
Delaying rehab can be a big problem, especially for athletes who want to get back to their sport. One of the biggest risks is developing stiffness in the knee.
So that stiffness can really set someone back in their recovery.
Absolutely. Early and targeted physiotherapy is essential. It helps prevent scar tissue from forming, keeps the knee moving freely, and strengthens the muscles that support the knee. These are all key ingredients for smooth recovery.
So it sounds like there are a lot of factors to consider when figuring out the best way to treat a multi-ligament knee injury. And one of those factors, as the source points out, is the severity of the ligament tear. They use a grading system, ranging from grade 1, a mild tear, to grade 3, which is a complete tear.
Right. Imagine a rubber band. A grade 1 tear is like a small nick, while a grade 3 tear is a complete snap. This grading system helps doctors determine the most appropriate treatment approach.
That's a great analogy. So for those less severe grade 1 and 2 tears, what does conservative management typically involve?
Conservative management focuses on strengthening those muscles around the knee and reducing any inflammation.
So even with those less severe tears, having a structured rehabilitation plan is still super important.
Absolutely. A good rehab plan is key to getting back to full function. However, it's important to remember that even if you start with conservative treatment, surgery might still be necessary down the line.
What kinds of situations would lead to a decision to operate, even after trying conservative management?
If someone is still having a lot of pain, that limits their daily life, or makes it hard to do their physiotherapy exercises, that's a sign surgery might be needed. Also, if the knee feels unstable, like it could buckle or give way, that's a red flag.
That makes sense. You wouldn't want to risk further damage to the joint.
Exactly. So the decision to operate always involves a careful evaluation of each patient's individual situation.
Now, the source also mentions a helpful flow chart. That outlines the entire decision-making process for managing multi-ligament knee injuries.
This flowchart is a great tool for doctors. It helps them navigate the complexity of these injuries and come up with a treatment plan that's tailored to each patient's unique needs.
It sounds like a really useful resource. I'm eager to hear more about this flowchart and what it takes into account when making treatment decisions.
Let's see. It's interesting. We often focus so much on whether someone needs surgery or not, but there's so much more to a successful recovery than just the type of treatment.
That's a great point. So what's the most important message for our listeners? Who might be dealing with a multi-ligament knee injury or know someone who is?
I think the key takeaway here is that a well-structured rehabilitation plan is absolutely essential, regardless of whether you have surgery or not.
And the source really emphasizes that rehab for these types of injuries is a long-term commitment. We're talking months, maybe even a year of dedicated work.
That's right. It's not a quick fix. And that's why having a skilled physiotherapist on your team is so valuable. They can guide you through each stage of recovery, starting with managing pain and swelling, then gradually increasing your range of motion, and eventually building strength and getting you back to doing the things you love.
The source also mentions that the goals and timeline for rehab can vary depending on the specifics of the injury and the type of surgery, if any, that was performed.
That makes sense. For example, if someone had a more complex reconstruction, where the joint had to be realigned, their rehab would likely be more extensive compared to someone who just had a simple repair.
So it sounds like personalized rehabilitation is really the key.
Absolutely. It's all about working together, the patient, the surgeon, and the physiotherapist, to create a plan that meets the individual's needs and goals.
Now let's go back to the different types of reconstructions we touched on earlier. The source talks about single-stage, double-bundle PCL reconstruction and ACL reconstruction. I think for a lot of people, myself included. Those terms can sound a bit intimidating. Can you break them down for us?
Of course. Think of a ligament like a strong rope that holds the bones together. When a ligament is torn, sometimes it can be stitched back together. But if the tear is too severe, we need to replace the torn ligament with a new rope, which we call a graft. This graft can come from the patient's own body or from a donor.
So it's like rebuilding the ligament using new material.
Exactly. And when we talk about double bundle in PCL reconstruction, it's like using two ropes instead of one to rebuild the PCL. Imagine the PCL as a strong rope with two strands. In a double bundle reconstruction, we use two grafts to rebuild both strands, making the repair even stronger.
That's a helpful way to visualize it. Now, I notice the source uses the terms repair and reconstruction when talking about ligament injuries. What's the difference between the two?
Good question. A repair is like mending a tear in a piece of fabric. If the tear in the ligament is clean and the ends are still healthy, we can sometimes just stitch them back together. But if the ligament is too damaged or the ends are too far apart, we need to do a reconstruction, which is like replacing the torn rope with a new one using a graft.
So the choice between repair and reconstruction depends on how bad the injury is and the condition of the ligament itself.
Exactly right. And sometimes surgeons might even use a combination of both techniques, especially if the injury is complex.
Now, earlier we discussed how even with conservative treatment, surgery might sometimes become necessary. What are some of the warning signs that might indicate surgery is the better option?
If someone is doing everything right with their conservative treatment, but they're still having a lot of pain, that limits their daily activities or keeps them from doing their physiotherapy. Surgery might be something to consider. Another red flag is instability in the knee, if it feels like it could give way or buckle.
So in those cases, surgery might be needed to make sure the joint is stable and to prevent further damage down the line.
Precisely. It's all about finding the right balance. We want to try conservative management first, but we also need to be aware of when surgery might be the best choice for long-term health and function.
And the source provides that helpful flowchart to guide those decisions, right?
Yes, the flowchart takes into account all those important factors we've been discussing. The severity of the tears, which ligaments are involved, and if there are any other complications, like bone avulsions or patellar displacement.
It sounds like a really comprehensive tool. Can we dive into the specifics of that flowchart a bit more?
Absolutely. Let's explore how this flowchart helps doctors make those critical treatment decisions. Okay, so this flowchart we've been talking about, it's really like a roadmap for doctors when they're figuring out how to best manage a multi-ligament knee injury.
And you mentioned it takes into account the severity of those ligament tears.
Yeah.
Seems like that would be a major factor in determining the course of treatment.
Absolutely. The flowchart helps doctors determine whether conservative management is a viable option or if surgery is necessary right from the start. For example, with those grade 3 tears, where the ligament is completely ruptured, surgery is often the recommended approach. to restore stability to the joint.
That makes sense. You can't really stitch together a ligament. That's completely torn, right?
Exactly. But the flowchart also considers which specific ligaments are injured. Some ligaments, like the ACL, are crucial for stability and often require surgical reconstruction, especially in athletes who want to return to high-impact sports. Other ligaments, like the MCL, may have a higher chance of healing with conservative treatment, especially if the tear is less severe.
So it's not just about how bad the tear is, but also which ligament is affected.
Precisely. And the flowchart goes even further, looking at potential complications that can accompany multi-ligament knee injuries. Things like bone avulsions, where a ligament tears away a piece of bone, or patellar displacement, where the kneecap is out of place. These complications can significantly influence the treatment plan.
It sounds like this flowchart really helps doctors consider all the angles and create a truly personalized approach for each patient.
That's exactly right. It ensures that all the relevant factors are carefully considered, leading to more informed and effective treatment decisions.
Now, let's shift gears a bit and talk about the rehabilitation process itself. We've talked about how important early mobilization is, but I'm curious, what does a typical rehab plan actually look like for someone recovering from a multi-ligament knee injury?
Rehab is a journey that's broken down into stages, and each stage builds on the one before. It's a very personalized process, but the overall goal is to gradually restore strength, mobility, and function to the knee.
So where does that journey begin?
The initial phase focuses on protecting those healing tissues and controlling pain and swelling. This might involve wearing a brace to support the knee, using crutches to avoid putting weight on it, and doing gentle exercises to start regaining range of motion. Think of it like gently waking up the muscles and joints after a period of rest.
It sounds like a delicate balance between protecting the knee and encouraging movement.
Exactly. And as those tissues heal and the pain starts to subside, the focus shifts to strengthening the muscles surrounding the knee and improving stability. We want to build a strong foundation to support that joint. We also work on restoring proprioception.
Proprioception, I'm not familiar with that term.
Proprioception is your body's awareness of where it is in space. It's what allows you to move without having to consciously think about every little movement. When you injure a joint like the knee, proprioception can be affected. So part of rehab is retraining those sensory pathways to help you regain that sense of balance and coordination.
That's fascinating. So you're not just rebuilding strength and mobility, you're also retraining the brain to communicate effectively with the knee.
Exactly. And as the patient progresses, we introduce more functional exercises that mimic the movements they need for their everyday activities or for their sport if they're an athlete.
So if someone's goal is to get back to playing basketball, their rehab would include exercises that simulate running, jumping, and pivoting.
Absolutely. The key is to gradually prepare the knee for those specific demands. We don't want to rush the process and risk re-injury.
Earlier, we discussed conservative treatment for grades 1 and 2 ligament injuries. Can you give us some more specific examples of the types of exercises and modalities that might be included in that approach?
Certainly. Strengthening exercises will target those key muscle groups we talked about: the quadriceps, hamstrings, and calves. Exercises like squats, leg presses, hamstring curls, and calf raises are all great for building strength. And as the patient gets stronger, we can increase the resistance and the number of repetitions.
So it's a gradual progression, just like the overall rehab journey.
Exactly. We also incorporate modalities like ice compression and elevation to help manage inflammation, and pain medication may be prescribed as well if needed.
It sounds like conservative management really focuses on giving the body the tools. It needs to heal itself.
That's a great way to put it. We're harnessing the body's natural healing abilities and providing the right support along the way.
We've covered so much ground today, from diagnosis and treatment options to the intricacies of rehabilitation. I feel like I've learned a lot. And I hope our listeners have too.
Me too. Multi-ligament knee injuries are definitely complex. But the good news is that with the right approach, a full recovery is absolutely possible.
That's a message of hope I think a lot of people need to hear. Any final words of wisdom for our listeners before we wrap up?
If you or someone you know is dealing with a multi-ligament knee injury, remember that early diagnosis is key. Don't hesitate to seek medical attention. And once you have a diagnosis, work closely with your healthcare team to create a personalized treatment plan that takes into account all of your individual needs and goals. With dedication and the right support, you can overcome this challenge and get back to doing the things you love.
That's fantastic advice. Thank you so much for joining us today
Yeah,
and sharing your expertise.
it was my pleasure.
And to our listeners, thank you for diving deep with us into the world of multi-ligament knee injuries. We hope you found this deep dive informative and empowering. Until next time, stay curious.